everyone. This is Esteem Radio Vision Ilesha Osho State. And you are welcome to another edition of Health Corner, sponsored by Foundation. Sponsored by Foundation. And a special thanks to the founder of this foundation, in person of Deacon Michael Adeboye Hashaolu, and to every member of the Esteem Radio Vision. My name is Olaamy Debbzy Afolabi, and I have here with me.
All right. Thank you, Olamide. We say a big thanks to all our viewers for joining us once again on your favorite program. That is the Earth Corner. And Olamide, I would like you to tell our people what we do on the program. But before then, I still remain my humble self, Adenipekun Afolabi. Olamide, let's have what we do on the the Earth Corner. When you say something is at the corner, and this is talking about the Earth, what are we doing on the program?
Alright, this program is designed to inform you and to also enlighten you and to also help you make healthier choices in your health. So today we'll be discussing about a topic called hypertension. As we all know, we all think hypertension is meant for only old people, but to be sincere, it's meant for both young and also old. So we have here with us online Mrs. Nwoko Ezinne Mary Constance.
And that is our guest.
Yes, she's a professional nurse. She has been in this field for a very long time. So she's here to enlighten us and let us know more about what this hypertension entails. Ma, it's nice to have you here, ma.
Nice to have you too. Thank you so much.
Thank you for joining us today, ma.
You're
Alright, let's get into this conversation now. Ma, we would like to know more about hypertension, because most people now out there, they think hypertension is meant for older people. So we want you to enlighten us and let us know more about hypertension, ma.
all right. Hypertension, as the name commonly implies, it commonly means high blood pressure. Simply put it, high blood pressure. It is a medical condition in which the force of blood pushing against the walls of the arteries is consistently too high. And over time, this extra pressure can damage the blood vessels and lead to a serious health problem. So commonly put it, hypertension is known as high blood pressure. And what do we mean by high blood pressure? When your blood is pumping against the walls at a very high pressure, and with time, the pressure will not damage the blood vessel in which it is running into and cause health problems, serious health problems. Thank you.
I have a question. Is this something that people can easily notice themselves without going to the hospital to check it out?
Well, just like I said, there's a word that people say about this health condition known as hypertension. It is actually universally known as a silent killer. There is no way you can know except if you are checking your blood pressure regularly. So you may not see signs and symptoms. By the time you see signs and symptoms, it has already gotten to a very high pressure that can lead to stroke. Those signs and symptoms could be something like headache, dizziness, or nosebleed. And when all those things happen, it has already gotten to the stage that it is so high that you cannot manage it, and it has lingered over a time. So that is why it's not something you say, let me wait. When I start feeling like this, I will know it's hypertension. No, it will not show you signs. It is just in some few people that it will show them a sign of headache, and by that time it has gotten so high, or nosebleed, or dizziness. By that time it must have gotten so high. But on a normal condition, on a normal person that is hypertensive, you can see somebody with a blood pressure of 170, 180 still walking on the road. Not until the person checks his or her blood pressure. So that is why you see some people, they say that somebody was healthy walking on the road and all of a sudden the person slump. It means the person has not been checking his or her blood pressure, and with time it now causes what we call stroke or any other health challenge. Thank you.
Thank you for that beautiful response. Looking at the topic that we are considering today, which is hypertension. Should we now, okay, is there any difference between when your blood is high and when the blood is low? Can we categorize both as a hyper, or what? I want you to shed more light on this.
Yes, there is hypertension. There is also what is known as hypotension. Hypertension means high blood pressure, while hypotension means low blood pressure. Both extremes are dangerous. In fact, hypotension is more dangerous because it can kill so fast. So what it means is that if you are checking your blood pressure regularly, you'll be able to know whether you are having hypertension or hypotension, or your blood pressure is within normal range. You cannot know any of these things except if you are checking your blood pressure. So we have hypertension, we also have hypotension. Hypertension means high blood pressure, while hypotension means low blood pressure. Thank you.
Okay, how can this blood pressure be measured? If someone wants to measure it, how can someone measure that, okay, to know whether it is hyper or hypo, like you said?
Well, you can only measure it with an instrument called the sphygmomanometer. Health professionals like doctors and nurses can check it for you. You can go to a hospital and they will use what we call sphygmomanometer and check it. We have the mercury type, we have the electronic types, but most times we advise some people to go to the hospital so that they can use the mercury type to give the accurate reading. So you check it with what we call the sphygmomanometer. That's the medical name for the instrument for checking blood pressure.
All right, you talked about that. If someone wants to get the accurate measurement, someone needs to get to the hospital. What about those who are using the machine, the electronic machine to check? Can they get the accurate measurements?
Well, they say that half bread is better than none. While the mercury built-in sphygmomanometer remains the most accurate one, the electronic one can equally give you an idea. It is better to use that one than not to check at all. It will give you an idea. Maybe the difference between the mercury one and the electronic one might not be much. So it will give you an idea of whether you are hypertensive or hypotensive or normotensive. What I mean by normotensive is your blood pressure is within normal range. That's what I mean by normotension. So instead of you not to take it at all, you can actually use the electronic type and check it. It will still give you a range, an idea of what is going on in your blood pressure. Thank you.
All right, ma. Thank you for that, ma. Ma, can you help us understand how we can read these measurements?
Well, there are medical terminologies used in reading these measurements. It is known as the first bit is known as systolic, while the second one is known as diastolic. So it is called systolic blood pressure and diastolic blood pressure. And what I mean by, let me explain more on what I mean by systolic and diastolic blood pressure. When you talk about the systolic blood pressure, for example, if you go and check your blood pressure now, they will tell you let's assume is 120/80. What they mean by 120/80, 120 means the systolic, while 80 means the diastolic. And the systolic means the pressure in the heart when the heart beats, the pressure within the heart when the heart beats, talks about the systolic blood pressure, which is the top number, which is 120. Then the diastolic is the bottom number, which measures the pressure in the heart when the heart relaxes, because during the course of the heart pumping, it pumps and relax. It pushes blood and relax. So that time it is pushing blood, the pressure inside it is known as the systolic blood pressure. The time it is relaxing, the pressure inside it is known as diastolic blood pressure. That is why we say it is 120/80, 130/70, depending on the range. So top one, systolic, down one, diastolic. Systolic, pressure at heart when the heart is beating. Diastolic, pressure at when the heart is resting. Thank you.
Okay, I want you to help us to re-explain this. You know, you talk about the systolic and the diastolic. I want you to explain what you mean with this, and together, if you can help us to talk about the normal range of the blood pressure.
All right. Like I said before, the terminologies might sound a little bit more medical. Like I said, systolic just means the first number you read. Like when you are when you are using the machine, the sphygm manometer, it will get to a point when you are releasing the cough, it will start beating. The first beat you hear is known as the systolic blood pressure. And that systolic blood pressure means the pressure within the heart when the heart is pumping blood, when the heart is beating. Because there's a pattern by which the heart beats. It beats with what we call the lop-dop beating. Lop-dop beating. So when it's beating, is known as the systolic blood pressure because the pressure within it is measured that time. That is what you hear the first time it beats. You read it from the sphygm manometer. Then the last time you hear the blood pressure beating is known as the diastolic, which is the bottom pressure. Then it means the beating you hear when the heart is now resting, when the heart is no longer pushing blood. That is the diastolic blood pressure. And the normal blood pressure, according to World Health Organization, it is actually a range. You have what you can categorize them as between 120 over 140, between 120 to 140 millimeter mercury to below 80 to 90 millimeter mercury. 120 to 140 being systolic, below 80 to 90 being diastolic. Anything above 140 for systolic is hypertension. Anything above 90 diastolic is also hypertension. Anything below 60 for diastolic is hypotension. Anything below 110 down thereabout is known as hypotension. So the normal range, according to World Health Organization, is between 120 to 140 systolic and below 80 to 90 diastolic. Thank you.
Thank you for that, ma. What leads to high BP? What are the common causes of hypertension? Are they mostly lifestyle based or genetics, or it's mix of both, ma?
Yes, it's actually mix of both. Genetics, common causes of this hypertension, genetics plays a role. If someone's parents suffered from hypertension, there's a tendency that if the person does not manage his or her lifestyle very well, he or she can also come down with hypertension. Then stress, inability to manage stress very well can also cause hypertension. High salt intake. If you take a lot of salt, it could increase your blood pressure because salt increases blood pressure. Then lack of exercise. If you don't exercise daily, it can also lead to high blood pressure. Then obesity. There's some people that are so big that their arteries, the arteries of their blood vessels are so much, kind of clotted with what we call atherosclerosis. So it can cause high blood pressure because those fats depositing in their body is also depositing inside their blood vessels, thereby making the lumen of their blood vessels narrowed, increasing the blood pressure. That's how obesity causes hypertension. Then smoking is also known to link to hypertension. That is why you tell smokers to quit because it's not healthy to their body. Then chronic illnesses such as kidney disease and diabetes can also cause hypertension. Thank you.
Okay, thank you for that response. You said stress are part of the common causes of hypertension. Now, I want you to shed more light on this. Some people cannot differentiate between being stressed and having a normal exercise. Okay, someone who walk like let's say 3 or 4 miles in a day, and someone who is walking throughout his day, should we now say maybe both of them is it not the same, or is there any difference between that scenario? I want you to look at it from that description or the narration.
Well, you know, when you are exercising, you are being intentional about it. There's a difference between the fact that you really want to trek to 3 miles than is a necessity, is a must that you trek to 3 miles every day to go to work. That tension, anxiety of will I get to work early? This one I'm walking to the office without, I don't have money for transport. That stress alone, thinking of anxiety and thinking of how to get to where you're getting to because of lack of funds or whatever is a stressor. You are trekking quite all right, you are exercising quite all right, but you are not really exercising with the mindset that you are trying to make yourself healthy. You're not exercising in the mindset that you are trying to build your body to be strong enough to defend yourself, to defend it from infection, to defend it from being hypertensive or losing fat or staying healthy, because exercise makes you to stay healthy. So you are doing it with the mindset that you are stressed up, you are anxious, so it is not exercise. With exercise, you find out some people they even walk more than 3 miles. You see them singing songs, being happy about it, enjoying the moment. That is what is called exercise. It's not about whether you trek and you are under stress, you are trekking under stress because you must trek for the day. You don't call it exercise. It's not exercise, it's actually stress. But when you are intentional about it and you are doing it with all happiness, then it's a healthy exercise. Unlike someone that is forced to walk the same 3 miles because he doesn't have funds to get to where he or she is getting to. It's actually stress in that scenario. Thank you.
Okay, thank you, man. And somebody like me, I would like to know, and I know our viewers also would like to know the symptoms of hypertension. What are the symptoms of hypertension?
Well, like I said before, it doesn't have symptoms. In most cases, you can't see any symptoms. In majority of the people, you can't see any symptoms. That is why you can see someone that has a blood pressure of up to 100, 180, 190, 200, still walking on the road without he or she knowing it. And when you tell the person to go and check your blood pressure, you say, no, I'm fit, nothing is happening to me, because it is a silent killer, like I said before. It is only in some few cases when it has gotten so high that you can no longer manage it again, that it will start showing you something like headache. You might start feeling headache, you might start feeling dizzy, or even there will be blood in your nose. Your nose will start bleeding. That is to show that it has gotten so bad that if you don't do anything, it could lead to something dangerous. And that is why it is known as a silent killer. It doesn't have any signs and symptoms. So you can only detect it when you check your blood pressure regularly. That is the only way you can find out that you are having blood pressure. It doesn't have signs and symptoms. The signs and symptoms comes when it is deadly, when it is too late, when it is too high, that you have to do something urgently to stop it from causing deteriorating effects on your body. Thank you.
All right, thank you, ma. For those that have hypertension, what are the treatment options, ma?
Well, the treatment options are categorized into 3 phases. First of all, there's what we call lifestyle changes. If it is a mild hypertension, remember, there's something I like us to know. This high blood pressure has ranges. You have mild hypertension, you have severe hypertension, you have moderate hypertension. So with lifestyle changes, people with mild to moderate hypertension can actually adjust and come back to normal blood pressure. Something like changing their diet, exercising regularly, reducing stress, and reducing salt intake. But people with moderate to severe hypertension, lifestyle changes alone may not be able to be enough to correct their blood pressure back to normal. They have to go ahead to add up to medication. So if lifestyle changes are not enough, medication is the next line of action to curb up hypertension, to reduce the blood pressure to normal. So you find out you meet your doctor who checks your blood pressure and know whether to place you on any type of antihypertensive. We have different types of antihypertensive. You have the calcium channel blockers. You have different types depending on the level of blood pressure, depending on whether it's a severe hypertension and the causative, what is actually causing the high blood pressure. Then another common treatment option that is very, very important is regular monitoring. This regular monitoring is both for someone that is actually trying to check his or her blood pressure and someone that is already hypertensive but that wants to be taking his medication. You find out that there's a way, if you're already on medication, you are meant to be checking your blood pressure before you take your medication, because there's sometimes you wake up, your blood pressure will come back to normal on its own or even below normal. So at that point, you are not meant to take your antihypertensive again, because if you take it, it might crash the blood pressure. But if you are with a good management, with your good medical checkups and management protocols with your doctor, he will tell you what to take. If the range, he will tell you a range. If it is between 120 to 120/80, he might tell you, okay, since you are taking, let's assume you're taking Ardomet 500 milligram, you can do 250 milligram daily or BD. If it is more than 120/80, you can do back 500 milligram daily or BD, depending on what you get. So for anybody that is having high blood pressure, it's very important the person has a sphygmomanometer at home, which he or she can use. This is where the manual, the electronic type can give you an idea of what is going on, so that you don't go ahead and crash your blood pressure with medication because you are trying to check it, to treat it. So it tells a lot of things. So it then tells you, knowing what is even normal blood pressure, so that you know when to take your blood pressure antihypertensive and when not to take it, and when to report to your doctor for adjustment and all that. Because there's sometimes you take your antihypertensive, the medication may not be bringing down the blood pressure. So you also need to see your doctor so that he or she can also adjust your blood pressure medication. So things like lifestyle changes, medication, and regular monitoring are the treatment options for hypertension.
Okay.
All of them. Okay.
All right. Thank you, ma. We have one of our viewers is asking. She is asking you a particular question. That is Mary Obi.
Okay.
Thank you for joining us, Mary Obi. She asked that, do hypertension affect pregnancy, and if yes, how?
Yes, it does affect pregnancy. In fact, in pregnancy, that's what we know hypertension in pregnancy is called preeclampsia. In pregnancy, it can cause a lot of damage if it's not well treated. You can see some pregnant women, some of them, you find out that their legs are swollen, their blood pressure is high, and when you check their urine, you find protein. These are the three cardinal signs to show that that pregnant woman has hypertension, and it's a serious condition in pregnancy. If it's not well managed, the woman can have what we call eclampsia, which is the proper fitting. What I mean by fitting is like a convulsion in the pregnant woman, and it can damage a lot of things. So that is why it is very important, if a woman is pregnant, he or she should be doing regular checkup, because pregnancy can also precipitate hypertension. There's some people that are not hypertensive naturally when they are not pregnant, but when they become pregnant, they become hypertensive. So they need to be checked always. They need to be going for regular checkups, take their medications, see their doctor. They're not meant to buy any counter drugs to take care of their high blood pressure. They will do all that their doctor tell them to do, so that they will prevent what we call eclampsia. Thank you. I don't know if I answer your question, Mary.
Mary, she's also listening to you, and I believe that she have already got your message.
Now, for
All
those
right.
that got treated for this hypertension, is it something that can be fully gone, or is something that they just have to maintain throughout their life?
Lifetime.
Well, it all depends. Like I mentioned before, we have mild hypertension, moderate hypertension, and severe hypertension. If it is a mild hypertension, when you change your lifestyle, if you reduce salt intake, exercise regularly, eat reduce stress, your blood pressure could come back to normal again. So you live a normal lifestyle. That means it has been treated properly. But you still have to observe all those things so that you don't go back to hypertension. But if it is a severe hypertension, most likely you are going to be on medication for a lifetime.
Okay, is that any,
So,
I want to ask this question because I'm not clear and I need clarification on it. Is there any correlation between the cardinal arrest and the hypertension?
cardiac arrest.
Cardiac arrest rather.
Yes. Okay. Yes. When you talk about cardiac arrest is a condition whereby the heart stops beating. There's a lot of things that can cause it. Though high blood pressure can also lead to that, can also be a contributing factor depending on what is causing it. That's what we call atherosclerosis, which means the position of fats inside the blood vessels, thereby causing the lumen of the blood vessels to be narrowed and the pressure within the blood vessels to be high. So when you talk about cardiac arrest, it means your heart suddenly stopped beating, and it can only be resuscitated through what we call CPR. That's cardiopulmonary resuscitation, and that is if someone that knows the signs and symptoms of cardiac arrest meets you on time and was able to do what we call CPR. That is compression and air ventilation through the mouth to mask and chest compressions. So it can actually cause that. That is why we tell you check your blood pressure regularly, because it can lead to other deteriorating heart disease conditions such as stroke, even that same as cardiac arrest and all the rest of them. So, but it's not something that just happen just ordinarily. Something leads to it. That could be accumulation of atherosclerosis. That could be blockage of release of blood clots, which goes to block the blood vessels in the heart, leading to ischemia and all the rest of them. Thank you.
Okay, thank you for that beautiful response. If someone is living with the hypertension as a hypertension patient, and if he failed to treat the hypertension, what are the complications that such person should be expecting, or what are the complications of if someone did not treat hypertension as it's supposed to be treated?
Well, like I said before, you find out that some individuals that claims to be superhumans, when you tell them check your blood pressure, they will not. You find out these days young people are coming down with what we call as stroke. Stroke is sudden paralysis of partial or a whole part of the body. It can be part of the body. It can be all the four quadrants of the body. It can be partial or it can be total. So something like stroke, heart disease, blood vision or vision problem, kidney disease, and aneurysm are some of the causes or complications of hypertension if it is not treated. So if you do not treat hypertension, it can lead to what we call stroke. It can lead to all these heart disease like the cardiac arrest you talked about if you don't treat it. It can lead to the vision problem because the blood vessels in the eyes would not be narrowed. Like I said before, I talked about atherosclerosis. Atherosclerosis means the position of fats inside the blood vessels of every artery. And you know the arteries in the eye, they are small. When fat deposit, what I mean by atherosclerosis is fat. They actually flat deposit or plaque. When they deposit there, they occlude the lumen. So, and when they occlude the lumen, there will be no more blood supply to the nerves that are responsible for vision. Thereby, it will lead to vision problem or even blindness. Then it can also cause kidney problems because of also the narrowing of the blood vessels supplying the kidney, which can shut down the kidney. It can also lead to aneurysm. Aneurysm means rupture of those blood vessels. When they are now so narrow that the pressure inside them is too high, they can burst open and start bleeding. So these are some of the complications of hypertension when it's not treated.
Thank you
Thank
so
you.
much for that, ma'am. Moving forward, what is your advice to the public for those people that have it and have families that have it? What are your advice to them, ma'am?
My general advice to everyone, both those that are already diagnosed with hypertension and those that are not yet diagnosed with hypertension, is regular BP check, regular blood pressure check for both healthy individuals and those already diagnosed with hypertension. And those already diagnosed with hypertension, my advice to them is to adhere to their drug regimen as prescribed by the doctor. Don't say that your doctor have written Adomet for you. When it finish, you go and buy another Adomet. Maybe if you are, it depends on what he or she is finding out in your finding out when you come each time you come for medical checkup. He might give you Adomet this time. When you come next time, he might give you nifedipine, depending on if it is going higher or coming down. So you have to adhere to drug regimen as prescribed by the doctor. Then you have to go for regular body checkups. But regular body checkup is very important for everybody, at least every 3 months, every 6 months, every 1 year, depending on how much you can afford. And these days there are health insurances that can help you reduce the cost of health examinations. And blood pressure check is not even expensive. There's also vendors that carry blood pressure machines around that you can also check depending on where you can see them and how busy you are. So the most important thing is to have an idea that you are either hypertensive, or normotensive, which is very important. Then also another advice is for people to engage in healthy exercises, not stressful exercise anyway. Then manage stress. Everybody has stress these days, but you try as much as possible to manage your stress. Rest as much as possible, drink enough water, hydrate yourself, rest very well as much as you can. Then reduce excess salt intake, because excess salt intake is not good for the body. It can cause or lead to hypertension. Thank you so much.
Thank you so much, ma. Thank you for sharing this knowledge with us. Thank you so much. We really appreciate you, ma. And to everyone
Yeah.
watching us, we say thank you for waiting till the end of this program. And to
Executive producer,
executive
and that
producer,
is taking Michael
Asha.
Adeboye Ashaolu, who is also double with the founder
Founder.
of Eni Akmole Foundation, who sponsored this program for us to know, for us to be healthy. If you don't know, you won't know that, okay, this is, maybe you are the carrier of this thing, or you are having the hypertension, like yesterday that we discussed about the malaria, and today we are on hypertension, and nobody is praying for this disease, or is it a disease or sickness? How you rate it?
For hypertension, you can call it a medical condition. It's
Okay.
not actually a disease. A disease is something you can contract. You
Okay.
can call it a medical condition.
All right. Okay. Thank you for that enlightenment. And I believe every one of us, we are already aware that we should go for our regular BP check for us to be healthy as individual. And if you know that there is tendency, maybe you are aware, or you know that your parents asked this before they, maybe even they are still alive or left, you yourself, you should work towards it so that you will not be partaker of that hypertension. And we pray that for those who are hypertensive, uh, God in his infinity mercy will lay his the healing on you. And you know, this healing, it is not only on prayer. You have to take a step like our nurse advised us that we should do. Once again, thank you for giving us this beautiful advice for today, ma.
You're welcome. Thank you so much. It's my pleasure.
All right. I believe tomorrow you will still be on the program. Thank you so much. On this note, we want to say a thank you to every one of you, especially those who being in support or assist us in one or the other. Let me start from the Chiamaka Obidike and the man behind the console, that is Balogun Abdul Samad. Thank you so much. We really appreciate you. Till next time that we meet or on this program Earth Corner, I still remain my humble self, Adenipekun Afolabi. From me, I'm saying bye for now.
And I'm Olaamy. So stay informed and stay healthy. See you next time. Bye. Bó bá ṣe bí ẹni bá rẹ̀ àbí kò tún